Okay, so today I'm going to be demonstrating a chest tube dressing change. So I've already introduced myself to the patient. I'm going to now wash my hands before entering the room and perform my entrance safety check. I'm also going to be explaining the procedure to the patient. So today I'm going to be changing your chest tube dressing. The patient does have the right to refuse, however they did agree to continue with the procedure. So now I'm ready to open up my sterile field. I've also sat the patient up in a semi-Fowler's position. And now, because I don't have another table here, I'm just going to be opening my sterile field on this table, and it will be at waist height, just to maintain sterility. So keeping in mind, I'm just going to be touching the 1-inch border. And I'm going to be placing my garbage bag just somewhere on the patient's bed, but for right now, I'm just going to place it right here. Okay. And only touching the tips of the forceps, I'm just going to move them to the side. And for this procedure, I'm going to be using the no-touch sterile technique. Okay. So I'm going to be pouring my normal saline. And adding my drain sponges to my sterile field. And my Gelonette. So now that my sterile field's ready, I can now don my clean gloves and remove the old dressing. So while stabilizing the chest tube, I'm now going to just remove the edges of the dressing first. And I'm just going to note that there's no drainage. So I'm going to grab my blue forceps and remove the old Gelonette. And I can remove my gloves and wash my hands. So now I'm just going to assess the site. So I see that there's no redness, no swelling, no drainage, and the peri wound looks healthy. So I'm good to clean the chest tube. So I'm going to clean closest to the drain first, going all the way around. Okay. And I'm going to go around again in a circle, a little further away, without touching my forceps to the tube. one more time, a little further away. Okay. And now I'm going to clean the top of the tube. And the bottom. Okay. Now I'm going to dry. I'm gonna dry the tube. And one more time. Okay. So now I'm ready to add my Jello net. I'm just gonna remove the film. So now I'm going to put this around the tube, creating a seal. So I've created my seal, and now I'm ready to put my drain sponges on. And this one's going to be going in the opposite direction. So now I'm ready to put my Meafix on. And before I put this on, I'm just going to put my 4x4. And I'm just going to be tenting the tube. Creating a tent. Perfect. Okay. And then I'm just going to be washing my hands, performing my exit safety check, and documenting the assessment findings.